Lights, cameras, action. Thought it was bad when I
How are
was.
we looking, Dan?
And you are live.
Okay, after that, thank you. All right, so let's begin tonight's meeting with the Board of Education workshop for the 2024 budget. Would you all please stand for the to Pledge of Allegiance? All right, and veterans are authorized a hand salute if you so desire.
I pledge allegiance to the flag.
Here we go. I thought of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, thank you. All right, can I have a roll call, please, of A&T personnel?
Wayne Bragg. Joe Napick.
John Belvin.
Did you get those?
Okay, what about two Johns?
Boyko.
John Boyko present?
Yes, he is.
Okay. And the other John, I didn't hear.
John Belden is here also.
Okay, very good. Thank you. Okay, so as you all know, tonight is a workshop. Okay, and what we're going to do, all right, is we're going to hear from the Board of Education first. All right, please do not interrupt while the board is presenting their what they want to present. Okay. Second will be the Board of A&T. Now, I know members of the Board of A&T have already submitted some questions. So if you want to, read those questions yourself, that's fine. If not, certainly Mr. Sharonage or the President of the Board of Education can read them. All right. Then after the Board of Education is done, the Board of A&T, and that will be it. Members, people in the audience that are not members of any of the boards, okay, Board of Aldermen or otherwise, will not be authorized to ask any questions. So again, it'll be Board of Education, Board of A&T, Board of Aldermen. All right, thank you. All right, who would like to begin with the Board of Education?
I believe Superintendent Saranich will start for the Board of Education, I believe.
Okay, very good.
That would be me. So thank you very much for this opportunity tonight to speak about our budget request. I always like the opportunity to get together collaboratively to answer your questions. To Chairman Francino Quinn's point, what we have is we have a presentation with a series of handouts that we'll be giving to all the members here at the table. I appreciate the questions that we received from either aldermanic people or A&T in advance. We tried to incorporate the answers to those questions within what we're presenting tonight to make the evening a little bit more effective. So before I pass out anything, I do want to just reference the mayor's proposal and the night that he made his proposal. The mayor did make a statement that all of our decisions should be based in fact. And I cannot agree with him more. And what we will be doing this evening is presenting you facts relative to the Board of Education, facts relative to the Board of Ed budget. So once we present all those documents, by all means, myself, Todd Carroll will be happy to answer any questions that you may have. There's another point that I'd like to agree relative to the mayor's presentation when he gave his proposal was his statement. I want to thank you for his compliments that he made towards our school system. We are doing an amazing job. We have one of the hardest staff working here in the state of Connecticut And I'm extremely proud of them and proud of the achievements of our students. But that takes a lot of work. That takes a lot of time and energy, and it takes a community to continue to show improvement. And the community's number one contribution towards the educational system is their investment. And as Mr. Simonetti showed me before I came here tonight, I brought the exact same article. We should all be proud when we see the Shelton Herald about the achievements that our school system makes. And we will speak about those achievements, and we will speak about the cost relative to continue those achievements moving forward. So with that said, Todd and Carol, if you don't mind. To make the night easier, I'm giving you a folder that includes all the handouts instead of handing out handout one by one. I've also paginated them so we can follow along number by number as I'm discussing them. I have plenty more in my bag if we don't have enough. So just want to make sure that we don't run out. Yeah, sure. Nope, sure. I have plenty here. Sure. Okay. Did you get one? Did everyone at the table receive?
Yeah.
Did you receive one for the record?
Yes.
Okay.
No. We'll raise money for the education. Well, we need it.
So if you would just follow along, I will make reference by the page numbers on the bottom, what we're referring to. But the first thing that you'll see here is what we call the vision of the graduate. This is the mission statement for the Board of Education. This is posted within all our schools, in our central office. Our students know it. We write all of our goals relative to the district, the school improvement goals, and then subsequently the teacher's professional goals centered around this concept. This is a visual of a comprehensive document that we have. We've included pages of that district improvement plan within your budget books, but I just wanted to make a reference to this concept of a vision of the graduate. And what it really stands for is that particular concept is our job as a school system is to have our students from kindergarten through 12th grade successfully achieve each level so that upon graduation, they are career or college ready to move onto the world at large. It is what we believe in and is what we focus all of our goals on. You'll notice on the front a lot of the statements that are there about critical thinking, problem solving, collaboration, empathy. These are attributes that are hard to measure. These are things that you just can't put metrics to, but these are things that you'll all agree to are necessary in the 21st century to make our students successful. These are the attributes that are present and needed in the current workforce. So I just wanted to start that off where we talk about why we do what we do as a school system. If you join me in turning to page number 1, let's talk about student achievement. I just showed you the article that you've all seen. 4 out of our 5 elementary schools were recognized this past year as a school of distinction. Just to kind of quantify that, the last time that the state of Connecticut recognized schools of distinction was back in 2019. The reason behind that is obvious. During the pandemic, there was no accountability testing, so we had no test scores to go under. Back in 2019, we only had 2 schools recognized. So you can understand the achievement that our school system has made. And I do want to point that out, as we see quite often in the media, the downward slide in the nation and the state in education because of the pandemic. You hear about what they call the COVID slide, the learning loss because the time spent outside the classroom. And yet, and even though Shelton was impacted by that learning loss, we still demonstrated achievement. It's something to be very proud of. Another thing I'd like to point out that happened earlier this year is our high school became fully NEASC accredited. This is an achievement that has not happened in 10 years. It has not happened in 10 years. We've been partially accredited, but this is the first time in 10 years that we have received full accreditation from the NEASC. And that again is an attribute of a community effort to make that happen. How that relates to the vision of the graduate and what you saw on that front cover was when you look at the vision of the graduate, last year's scores that were published by the school system through the state of Connecticut, we have a 90% 4-year graduation rate, which means within 4 years, 90% of our students will successfully graduate. Obviously, it's not 100%, You know, there are some difficulties that may happen or circumstances that may happen with all students. And they do break that down further to what happens to the students who don't graduate in 4 years. There's other metrics that are measured, but 90% is good. 90% is great. And I do want to point this out with an interesting fact that we just learned this year when we surveyed our students. In our current high school, right now in our current high school, only 76% of all students currently attending Shelton High School did not go through the entire Shelton public school system, which means they've moved into Shelton sometime since kindergarten. We all know that Shelton is a city that people would like to move into. We all know that it's prospering in the economy. We have good demographics and things to offer here. And as we do, we're seeing a lot of populations come in here, but it does point out how it makes our job as educators more demanding. If our mission is a vision of the graduate and we don't get a hold of these students on day one of kindergarten, it makes our mission a lot harder. And right now in our high school, 76% of our current students did not attend any schools from K on. So it just talks about the demographic that exists here in our school system. But I do want to point out that these accomplishments are done through investments that the city makes. And we were very appreciative of every dollar that the city of Shelton puts toward education. But we were also fortunate within the past few years of receiving federal grants that I know the members of A&T and the Aldermanic Board are aware of. We've been utilizing these grants to help sustain our school system. And as you break down, the 3 largest grants that we received in the past 2 years were referred to as the ESSER funds. There was ESSER 1, ESSER 2, and commonly known as ESSER 3, but actually its title is ARP ESSER. If you look at this first page, you'll see the breakdown of the funding that came from these grants and how, for the large ticket items, we utilize this money to help sustain our school system. Through ESSER 1, which was the smallest of the 3, we purchased 900 Chromebooks. That was also right during the pandemic, and we purchased hotspots for families who are having difficulties with wireless because we were doing digital learning, alleviating that financial burden from the city. We were able to sustain education during the pandemic by using these funds. Then ESSER 2 came out, a little over $2 million. We utilized that funding after the pandemic to supplement our summer school program to help our students who had learning loss because of the pandemic, which by demonstrated and what we saw in this news article yield positive results because we did show that our schools performed well. We improved air quality, which alleviated the city of those particular maintenance aspects within our school system. And we purchased math and literacy programs that has demonstrated and shown great growth for our school system in wit and wisdom and the programs that we use here in our school system. With the last grant, which we are currently working off of and going to be zeroing out this coming year, which was the largest, which was 4.5 million. As this board is aware of, a major part of that went to the technology enhancements that were required in our school system. Our technology was out of date. The wiring, the Wi-Fi, the security networks that needed to happen, the security measures to secure data from the school system, which is also something that protects the city. We see often within the news of data being hostaged and ransomed, and we wanted to make sure that none of our secure data on our students would fall into that trap. We spent about 1.4 million of the 4.5 on technology enhancements alone. Along with that, we continue to improve our curriculum. We provided needed professional development for our staff. And of course, we utilize that money for staff, which we'll talk about this evening. In those grants in the past 2 years, it totaled a grand total of $6,918,890. Not a single penny of that money came out of Shelton taxpayers, or was impacted the Shelton mill rate. That was all through grants, and it shows and demonstrates that there is a correlation between money invested and performance in a school system. Well, now we're at critical mass. We've talked time and time again about the financial cliff. We talked about when the money runs out, what are we gonna do? And here I am today to speak to all of you, asking what are we gonna do because we no longer have the federal grant money. If you call the governor, I'll would you make that phone call with me, Mr. Ingles? We can call them together. So if you want to turn to page 2, again, based on some of the questions that I received prior to this presentation regarding student performance, I just want to highlight some of those achievements that our school system has made. There are 2 measures that the state of Connecticut uses. They're called accountability assessment measures. In grades 3 through 8, it's the Smarter Balance Assessment. That'll be taking place right after April vacation. And in the high school level, grades 9 through 12, it's measured with the SATs. The SATs in Connecticut is the accountability measure. The top bar graph demonstrates our performance relative to the Smarter Balance. You will notice that both in math and LA achievement, you will see from, again, I have to go back to 2019 because that was the last time that we had registered scores. To this past year, you can see the increase in our district as a whole. So overall, our district is performing, and then some of our specific schools were highlighted for that achievement. In the SATs, we were not as fortunate to have as good growth as we did with the SBAC, but as demonstrated in the graph below, Shelton is still performing over the state average, which has always been a measure that we've always wanted to achieve, and we wanted to maintain. And despite setbacks with learning loss during the pandemic, we were still able to maintain over that state average. Page number 3. Many of you have probably seen this before. I think it's page 11 in our budget book. It's page 3 in the handout tonight. This is what we call our financial walk. This is basically our budget request from the Board of Ed. What the Board of Ed did through a series of workshops putting together, looking at the needs of the school system. My glasses. Putting together the needs of the school system, voted by the Board of Education, put forth to the mayor before the February 15th deadline. What I'd like to do is kind of just reflect on, I know all of you've probably seen this document, but for the purposes so that we could all understand what we're looking at, I'd like to just briefly walk through here so you can see where our request came from. So the top gray line talked about our current budget. That's our operation budget of this year, the 75 million plus. And then as we went through it, these are the areas that we were requesting increases. The largest line item is the first line item. It's with the certified staff. This is a contractual increase, mandated. We have no ways around changing that number. This is done by all the contracts with our certified staff. And what I have to say is all the contracts that we negotiated in good faith. I know Mr. Ingles was observer of those negotiations. Most recently, the one that has the largest impact is the teachers, which actually went into a mitigated arbitration. So we did our best efforts on both sides, teachers and the city, to come up with an agreement in the best interest of the teachers and the best interest of the city, which worked to our advantage financially. The state average in settled arbitrations was coming out around 14%. The Shelton contract, we ended up with 11. So even though we look at that as a very high number, and I believe that teachers in our system deserve every cent that they get for their hard work, we were able to negotiate a very fiscally responsible contract for the city itself. And now is the time where we're obligated to pay what is due to them. The next line is our non-certified staff. Again, contractual obligations, but we talk about non-certified. It's basically the difference between certified staff in the school system are all of our teachers and administrators. They have a certified license by the state of Connecticut. All other staff would be non-certified. They may also be in bargaining units as well. As I mentioned, when I did the breakdown of the grants that we did utilize grant funding to pay for staff. In the original proposal with the Board of Education, We talked about maintaining that staff, keeping that staff with us. We believe that it's been very helpful to our school system and its success and the well-being of our students. But what we were able to do is zero out all grants we had. So without eliminating any staff that we added on with the grant funding, we will at least have one more year without putting any additions onto the city's request by utilizing that grant money. And as you'll see in this walk, that's in front of you, it's colored. Anything in red was an initial request by the Board of Education that we saw as an area of funding that we decided to zero out all grants at this point. So although it's not a discussion point for tonight, it's a point of interest because we'll be talking about that next year at this time. But then we go down to benefits. Second largest number on the list. We will specifically speaking about that number relative to healthcare costs. I know that's been an issue for the city as well as the Board of Ed. And after this walk, we'll break that area down. We go to tuition costs. There is a state mandate called Open Choice, where students have the ability to go to specialized high schools or other programs outside of the city of Shelton if they have the choice and the ability to do so. We are mandated to follow it, and the Board of Education follows all state and federal mandates. We have no option to pick or choose which ones we want to follow. We follow every single one. With the open choice, if a child does decide to go to those schools, we need to pay their tuition for them to attend. One of the schools that's involved in this is Fairchild Wheeler, which I'm sure the city is familiar with. But recently, in the past few years, at least when I was superintendent, there was a lawsuit with the city of Bridgeport and the state that Shelton was involved in, and we did have a settlement with Shelton on that lawsuit. And as part of that Shelton lawsuit, we are obligated to send 50 students to Fairchild Wheeler. That is part of our settlement. Those 50 students have a tuition. Again, we have an obligation to fulfill that by a settlement in the court that we worked out, the city worked out in terms of that, and we need to follow through. Utilities, again, an issue that everyone is experiencing. These numbers that came up, I will credit Todd with as looking at the scales of where we are projected cost of utilities and natural gas. Then you'll see instructional supplies. Instructional supplies and custodial supplies, we can utilize the last remnants of the grant money. So we netted those down to zero in the walk. As we move forward, you'll see an asbestos plan update for $16,000. This again is another state mandate. It happens every 5 years. Every 5 years, the state is required to do an asbestos mandate and update on all of our schools. This happens to be the year that the 5-year time frame is due. So we have to budget for it because we are required to make sure it happens. As well as custodial and state mandates associated with maintenance, around 21,000. There have been bills passed in the state legislation that have required certain mandates relative to facilities and maintenance. Those mandates come with a cost. We estimate that cost at 21.5 thousand. You'll also see in here a staffing request. This is new staff. I'm sure you have heard, I've been attending the Board of Alderman meetings and such, where you've heard from the parent community the needs for class size reduction. The Board of Ed recognizes that need to reduce class sizes. And to help with that, we included a request to hire some additional teachers. That 577,000 includes some additional classroom teachers, as well as paraprofessionals and special ed staff to help the needs in those particular areas that have been identified. Special ed is another particular topic that we'll be breaking down as a whole. When we looked at the average run rate of our special ed expenditures, we've been short on a little less than $1 million in special ed. We're going to talk about that a little bit more specifically, but to accommodate that run rate that we saw, we included it in our particular financial walk. We are appreciative that there was no increase to the bus contract that we have with the city, so that was a zero. But it did bring the budget request that was approved by the Board of Ed of a budget request of $5,362,600. Giving us a grand total for next year's budget at $80,371,637. And that's the financial walk, which I'll be going back to before we end today. So the two biggest ticket items that have been requested to us before this meeting and points of discussion at several meetings prior to this has been healthcare and special ed. What we're going to do at this time, if you want to turn to handout number 4, page number 4, I'm actually going to turn it over to Mrs. Panazzo, and she's going to walk through these bullet points to address our healthcare issues.
Good evening, everyone. I'm Carol Pinozzo from the Board of Education. So on February 8th, 2023, our healthcare consultants for the city and the board, Smith Brothers, and our healthcare provider, Cigna, presented us with a look back over the last year and a half, which would include the period of COVID. And it addressed why we're seeing such high costs in healthcare. Currently, the board is overspent in their healthcare line, as is the city. So we know that. So our meeting was 3 hours. I promise that my my little part here won't be 3 hours, but I just want to take you through and explain to you what they explained to us. And so you can see where we are going in healthcare. And I'm going to start out by saying that this is going to be optimistic and it's going to be pessimistic. It's optimistic because we can keep our staff alive longer through good research and good medication. But that costs money. So the pessimism is, I don't see in the future that our healthcare costs are going to lessen. I believe that they're only going to increase. So let's go through why. One of the reasons why we saw or we are seeing increase in healthcare is because during the pandemic, our staff did not go and get their regular checkups for a variety of reasons, as we know. And so we know that through good research and good healthcare practices, that when someone is ill at a low level, for example, with cancer or with diabetes, we can take at an entry level. If we catch it early, then it's less costly and less traumatic for the staff member. But if that didn't happen in a number of cases over the pandemic, which led to what we call catastrophic illnesses. We saw 19 catastrophic illnesses from the last year and a half. And those are illnesses that cost us $175,000 each. After that, our insurance kicks in and we no longer pay. Then we don't assume any more costs after that. But we saw 19 individuals with catastrophic illnesses of $175,000 or more. I think the largest is over $2 million on that list. Okay, medical care. So we can prolong life in a number of cases, specifically for cancer, for diabetes, nationwide. The concentration now in healthcare and research is on cancer and cancer drugs. So we can keep people alive longer with good research, good medication, good medical practices. But those cost money. So specialty drugs, for example, if you were diagnosed with hepatitis several years ago, I had a family member who did die from hepatitis. He was given a blood transfusion when he was young and it resulted in hepatitis. He died of that illness. However, now there's a hepatitis drug that can cure hepatitis. That drug costs anywhere between $10,000 and $15,000 a month. That's called a specialty drug. So if you have several cases of that among your employees, your healthcare costs are going to increase. We have seen an increase in mental health during the pandemic for reasons of isolation or for reasons of anxiety, stress. We see more cases of We are seeing more cases among our employees, both on the city and the Board of Ed side, for mental health reasons. So that was another area that has increased. Unfortunately, we're seeing higher increase in drug addiction. Again, both sides, the city and the Board of Ed. So those are reasons that our healthcare costs are increasing. And I believe that they will continue to increase. So what are some of the measures we are trying to take to reduce costs? On the Board of Ed side, we have 6 unions. All of our union employees, as well as our non-union, have what's called high deductible healthcare plans with a health savings account. Those in the industry are considered to be consumer plans. It means that it's trying to teach employees to be more consumer minded in looking for lower costs for their healthcare. It's hard to believe, but depending on where you receive your healthcare, you may pay the same amount of money for the same procedure. And Fairfield County, where we live, healthcare costs in this part of the state are higher than in any other part of the state. Where you get your prescriptions filled, there's dramatic differences in where you would get your prescriptions filled. So through these plans, we try to teach our staff to seek out the lowest cost, because that benefits not only the employee, but it benefits our bills. We are self-insured. So although we have what a premium would cost to insure our employees, we only pay our bills as we go forward. So for example, a premium for a person who is single, only insures themselves, might be around $12,000. However, we don't pay $12,000 to Cigna. We only pay the bills that that individual incurs during the fiscal year, July 1st to June 30th of any year. Our healthcare plans include a deductible. So depending on who you insure, whether you insure an individual plus a spouse, or an individual plus a family, you pay a deductible. So an individual would pay the first $2,000. Individual plus spouse, individual plus family would pay the first $4,000 of the cost of insurance. Once you meet your deductible, you then have also a copay on your RX, which depends on what RX you're filling. It could be specialty drug, which would have the highest cost, a generic, or a dispensed as written. In the last 2 years, we've concentrated through Cigna on wellness programs. During the pandemic, we had a number of online wellness programs. We offered yoga. We offered cooking classes to our employees. We offered meditation. Meditation. Perhaps mediation was needed as well. But we've offered different programs online to help our employees get over, some issues that they might have experienced. We have a wellness coordinator that we share with the city of Shelton. He works part-time for us and part-time for the city of Shelton. He offers a number of different kinds of activities. He has a walking club. We have a program called Omada. It's not here, but it specifically targets people that have diabetes and obesity. And of course, it's volunteer, but there's different kinds of activities that employees can become involved in to help with their health issues. We also have a telehealth program. Telehealth program is for less serious illnesses, such as perhaps you have a sinus infection, perhaps you have a cold. You can, all you would need is a computer, which has a camera. You can get online with a doctor and you can be treated online. I've actually used that myself and it works very well. It's not for serious cases. If it's a serious illness, they will of course refer you to your physician, or you can go to the walk-in clinic. But those are some of the things that we have put in place to help reduce our medical bills. We know, and I want to stress that the earlier someone is diagnosed with an illness, the more effective our medical professionals can be in helping that employee not only get better, but go forward in a more healthy way. And so that's our concentration. We've stressed this with our healthcare provider, Cigna, to provide us with information, not only to help our employees, but also to reduce our costs. We certainly understand when we come to the table, the burden that this is on us.
Thank you.
Thank
Mrs.
you.
Bonanza.
Excuse me, Ken, could I add something to what Carol has just said? This is Paul Hiller speaking, Director of Finance. Carol has touched on many items here regarding healthcare. And one thing I should point out, and this relates not only to the Board of Education, but also to the city. As she's indicated, we've had several 21 cases which exceed the stop loss policy. We had to last month, back prior to March 17th, accept or reject a renewal on our stop loss policy. That renewal for both the city and the Board of Education adds 25.16% to that premium. I don't have the figure as to what that is for the Board of Education, but in the city's case, that is going to add, we're locked in to an automatic increase of $100,000 on the stop loss policy. One of the problems we've had is our experience over 3.5 years with Cigna has been at best what I would call difficult. They have incurred, their firm has incurred through December 31st in 3.5 years, a loss of $5.4 million on the stop loss policy for the city and the Board of Education. And so we're in, difficult times as far as that's concerned. And we have very few options really as to where to go. But I just wanted to bring that out because it relates not only to the Board of Education, but also to the city. We're in this together. Thank you.
Thanks, Paul. And it is an important part that we know the city is dealing with, and we appreciate the relationship that we have with the city in trying to solve the healthcare cost issues. I felt it important to highlight it because it is one of the top numbers in terms of our budget request. And also because the Board of Education clearly has more employees than the city side. So we have a larger workforce dealing with it. And as such, we are making critical steps to try to reduce the healthcare piece. As Mrs. Spinazzo outlined with the high premium cost share and the co-RX and all those steps, the Board of Ed is doing. I can't speak to the city's insurance plan for their employees, but I know on the Board of Ed side, we're putting a lot of measures in there to try to reduce those health cost savings. So if you turn the page, we're going to talk about the next big ticket item, which is special ed. And again, I just want to emphasize that we don't have an option as a Board of Education to not follow or pick and choose which mandates we want to apply. If we did this, we are dealing with educating children. And if we chose to not follow any mandates in the education of children, we're subjected to a lawsuit by those parents, which we will absolutely lose and go into a litigation at an additional cost for the city. So what we do is we follow every state and federal mandate that we need to comply with. So as I break down some of the facts on special education, I want to just emphasize something here that every child who receives special ed services, first of all, are due the rights to those services. Every child learns in a different needs, a different understanding, and it is our job to meet the needs of every child. And any child who qualifies for special education services are due those services by right. And we want to be obligated to follow through. Every child and every service that they receive comes at a cost. No matter how small that special ed service is or how large that special ed service is, they all have an associated cost. When you think about public education and you think about what happens in public education, general education for public education is the delivery of the core content. Reading, writing, math, social studies, science. Anything associated outside of those general curriculum contents falls in the area of special education and has a cost. If a child receives speech services from a speech pathologist, no matter how minor those speech services may be, it might be pushing done right in the class, it's a cost at the school system because we have to pay the salary for the speech pathologist. If no child required speech services in the Shelton Public School System, we would have no reason to hire a speech pathologist. It's not a requirement for general education. So every service a child receives, no matter how big or how small, comes with a cost. And as of March 22nd, and the reason why it's March 22nd, because we have to update, we as administration have to update our Board of Education for every monthly meeting on our current count. So as of the last Board of Ed meeting, which was last March, we currently have 811 students in the Shelton Public School System who receive special ed services. So if we break that down and you go to the first chart right below that, you'll notice that the 811 are broken down to 750 of those students attend Shelton Public Schools and receive some type of service within our school system. 61 of those students are what we call outplaced. They are students with severe medical or educational needs that we cannot provide here in our school system. We could provide it in our school system, but we would have to do a substantial investment into our programs to be able to provide those services that are done at outside facilities. But 61 of the 811 receive outside services. They're out of district placements. They go to specialized schools outside of the 8 schools in the city of Shelton. If you look right below that, at the first bullet, the average tuition cost, so this is the average, for those 61 students is around $95,000. That's what it costs for the tuition for those 61 students on average to attend those schools, that they are entitled by law relative to their IEP for their special learning and needs. Because these students live in the city of Shelton, they are Shelton residents, and they attend a school outside of Shelton, we have to transport them to that school. The average annual cost to transport those 61 students is approximately $35,000 per student. Some of these students have mobility issues. Some of these students may be in wheelchairs, and they require specialized transportation to get them to their facilities. So as you can see, there are costs associated with special education. Now, just like we did with healthcare, I want to point out some of the things that we are doing in the Shelton Public School System to try to mitigate costs in special ed. So if you look at the next chart on the page, you will notice that it says dismissed from special ed. So every year, a child, we look at the child's program, which is called an IEP. There's a team that is met of staff members as well as the child's parents. And if the child is old enough, the child themselves can attend the PBT as well. And we discuss the program of study and their academic progress. And the goal of all special education, is to have the child dismissed, is to not stay on services, but to be dismissed from services. And I say this story often because I'm extremely proud to say this, but one of my children, my middle child, was a student who received special ed service for a learning disability. And he to this day says one of the proudest moments that he had was when he was at Shelton High School and attended his PBT and was dismissed because he knew he made his achievements. And that is our goal. Our goal is to not keep kids within special ed, to not incur costs on the school system. Our goal is to provide the most appropriate program for those students and help them achieve. But we do our due diligence. We work with the families, we work with the students, and most importantly, our staff works hard to make sure that a student's receiving the correct, free, and appropriate education. And if you notice in the course of the past 3 years, we've dismissed students annually from services. In 2021, 53 students were dismissed. In 21-22, 57 students were dismissed. And this year, as of March 22nd, 49 students have been dismissed from special ed services. But here's the situation we have. If you look slightly to the right, you will notice a number, and that number indicates students who have moved into the city of Shelton after July 1st who have an IEP. So students who have attended other school systems who I'm sure have qualified for their appropriate services, move into Shelton. Why wouldn't they move into Shelton? Shelton's a great city to live in. We want people to move into Shelton. We make it attractive for people to live here. When people live here and they move into our city, we need to accommodate whoever moves into our city and accommodate the learning of those students. So in 2020, 2021, where we dismissed 53 students, 71 students moved into our school system that same year after July 1st. Our net add was 18. The following year, 56 were dismissed, 85 moved in, our net add was 28. And then this year, we've dismissed 49, and as of March 22nd, 88 students have moved into the city of Shelton with IEPs. So we're currently netting 39, and we still have 3 months of school left. So you can see that we're making every best effort to provide an appropriate education for every student who deserves that, those accommodations. Yet, those accommodations come with a cost. And as many students move out of special ed services, many more are moving in. And part of that, if you look below the next chart, we've discussed this before, but I think it's important that we understand this. In the state of Connecticut, there is a legal statute that we have to abide by that's called the burden of proof. The burden of proof in Connecticut is on the school system. Why that is important? Because in states of New York, in states of Massachusetts, bordering states, the burden of proof is on the family. In Connecticut, the burden of proof is on the school system. Well, what does that mean? If a family feels that their child needs special ed services, it is the burden on the school system to prove otherwise. We either provide the services as necessary, or we test the child to prove that they don't receive services. So let's go through the breakdown below. If a family says that their children need special ed services and the school system does not agree with the data that they need services, well then testing could be done by an outside consultant, which nets a cost of about $2,334. Because we have to prove that the child may not qualify for services. When that testing is over, the statute still allows the parents to contest the results of that findings. And they can ask for an independent evaluation. It becomes a legal matter at the PPT where we and the families have to agree upon an independent evaluator called an IEE, in which testing would take place to look at the services. That cost comes at an average rate of $4,227. Again, burden of proof on the city of Shelton. And even when that's over, if the parents still feel that their children deserve special education, they have the right to go into litigation. It becomes a legal matter, and we go into litigation for a mediation to have an outside legal mediator make the determination whether the child is going to receive services or not. That is turned over to our legal team, and our legal team gave me the number that it averages around $2,000 per day in mediation to mitigate a situation like this. So even as Shelton does our best to provide an appropriate education for all of our students, and every student that receives services deserves those services that we provide for them in their IEP. When we move a child out of education, if the families feel that it's not an appropriate time and want to challenge that placement, they have the right. And if we do not continue to provide the services, because we could just decide and say, okay, we'll continue to provide the services. If we don't provide those services, the legal aspect comes into burden of proof and the costs associated as listed in this document. So the last chart below is just some of the breakdowns in the Board of Ed budget and where we are in the 3 largest areas. There's tuition for special ed public and tuition for special ed private. I'll just explain what's the difference between those two. As we talked about, we are obligated to send 50 students to Fairchild Wheeler. Currently, I believe that we have 56 students from Shelton who attend Fairchild Wheeler in Bridgeport. If any one of those 56 students receives special ed services, they're entitled to those special ed services at Fairchild Wheeler on our dime, on the Shelton Public School System's dime, because they're our children. So those type of services in those schools would what we would call special ed public. kids are attending special ed public schools, and we're paying the costs associated with that. In our budget last year, we budgeted $1,489,013. That's what we budgeted. This year, we budgeted the exact same. We had to. We had no other recourse because we had no other sources of funding to raise that category anything we wanted. Private tuition costs at the 2 million plus is the association that we budgeted for those 61 students I mentioned above. Students who go to private facilities. In our budget last year, we did $2 million. In our budget this year, we did $2 million. We had no additional funding to raise that cost whatsoever. And then of course, we talked about the transportation at an average cost of $35,000 per year. We budgeted a little over $1 million last year. We again budgeted the exact same amount this year because we had no means to increase that. What you'll see is the projected overage, the overage and the projected overage. Last year, despite the cost associated with special education and the demands that it required us to properly fund education, we ended our budget in $139,000 loss. The city is aware of that. You helped us mitigate that cost and we appreciate that last year. But that's where we were when it all boiled down, and we helped utilizing our grant funding in other areas, moved around some monies and families, and that's where we ended. We did not project any of those line items further this year, and our current run rate for our projected over is $775,000. The Board of Aldermen were made aware of this as we just recently sent you all a letter to keep you abreast of the actions of the board. As indicated in the letter, we anticipate bringing this number down. We do have excess cost grants that come in. We have other areas in which we'll bring this number down as low as we can in the next three months. But our current projective as it stands before all other funding sources are applied is $775,000 over. This is where we get our projected ask in our financial walk. Another area that I want to point out relative to measures to reduce costs in special ed. Prior to me becoming superintendent, prior administration made a decision to outsource special ed services within our own school system. There's nothing inappropriate with that. It's just how you want to fund it and what you want to do. There's other outside facilities and organizations who will come in and work with our children and staff. We'll just pay them a cost. Prior administration thought that that was be a way to have cost savings. If instead of us adding our own staff, adding paraprofessionals and adding special ed staff to our general budget, they outsourced it. And we had a private company that came in. When I took over, obviously that was what was already in place. And that prior year, in the line item that paid for those services, we had an overage of around $168,000. The services that we were paying to these out companies cost more than we had budgeted. This past year, we made some significant changes within our school system. In working with our leadership team and working with our school staff, we eliminated any outsourcing or any outside companies from servicing our students. And our current line item in as of March 22nd, in that same line item for professional learning currently sits at $221,000 in the black. Obviously, with 3 months left, we're projecting to net that zero, but we are not projecting to have a loss. So it's important that I bring this up to this board because I consistently am asked it here, what's the plan? What's the plan to save money? What's the plan to save costs? These are the measures that are happening within our school system to make that happen. Because the plan, when you refer to plan, I think of IEP. And an IEP is a bounding agreement to provide services for the child. That's the plan for education. Our job collectively is to figure out how to fund it. So that's special ed. Let's turn to the next. The next is just an add-on that I want to point out to the Board of Aldermen and A&T. At last year, when the mill rate was set at May 26, 2022, at the aldermanic meeting. And the budget was set. There was a discussion that was voted upon by the Board of Aldermen, and as I recall, it was unanimously voted on that the Board of Aldermen would adopt in principle the creation of the Special Ed Reserve Fund. I bring that all to our attention because obviously that's needed. That was the purpose of the letter that we sent last month. We will continue to update the Board of Aldermen of what our situation is around special ed costs. And we look to you to collaboratively work together to help find those costs as we agreed upon a year ago. For those of you who did not see the letter, page number 6 in the document is the letter that was written by the Board of Education and Administration to the Board of Aldermen relative to where we are with costs. And let's flip to go to page number 7. Page number 7 is a chart. A pie chart, nice visualization that I want to share with everyone. Oh no, right, page number 7. Yep, page number 7, we have the visualization. I want to point out the visualization with the chart itself because I want to demonstrate how our budget operates. If you look at this visualization, I want you to focus on the orange, the yellow, and the green. Orange, yellow, and green in our budget deals with staff. All right, as you'll notice, that's the majority of our budget. When we talk about making cuts to the budget, the only way that we can save costs in our budget is going to be the effective of the staff. If you look at some of those other line items that are listed, equipment, instructional material, and such, they're coming in at 0% of the total budget. If we wanted to sit here and say, well, let's not affect staff, let's not affect kids, let's cut all instructional supplies. We'll figure it out. We'll cut all instructional supplies. We would net 0% on our budget to try to make where we are. So when we talk about our budget and how we can find cost savings, we have to talk about staff. So before I talk about staff and its effects, I would like you to turn the page to page number 8 to the updated financial walk. You will notice in this updated financial walk, to the left is the column that I went over at the beginning of this presentation. I walked you through each part of our needs. Carol and I kind of talked about those heavy items relative to special ed and healthcare costs. What the right side does is an estimated calculation of the mayor's proposal. The mayor proposed made a proposal of 77, sorry, I was finding number, 77,259,538. Thank you, Todd. We applied the mayor's proposal to our current budget request to see what the net loss would be and adjustments that we would make. The one thing that I want you to notice in the column, right, you will notice the line item that says staff, FTE, and paras at 577,000. If we had to go based on the current mayor's recommendation, our recommendation would be that we would net 0. The reason for that is, since we would have to make significant cuts to our budget, the idea of bringing additional new staff to our budget would have to be one of the first decisions to eliminate. As I said earlier, I think every member of this board, of both boards, have heard from the general public about the reduction of class sizes, about the needs for further teachers to try to make class sizes reasonable. That 577,000 was going towards to help mitigate those class sizes and also to support special education. That would be the first initial cut that we would make from our financial walk if we had to do anything. I want to touch base on that just briefly relative to the impact, because one of the things that I believe all of us are troubled with in the current situation that we deal with in our country is the association of school violence and the safety of our children. And we talk about a lot of measures that we can take to fortify our schools and make our schools safe. And I believe that our staff, our city, we all have the best interest in mind, and we're making those steps forward to fortify our schools, to make them safe for kids. But one of the biggest issues that we can work on in a proactive measure is providing an appropriate environment to work and an appropriate environment to learn. When students are in classes of 28 plus individuals, the environment is not conducive for learning. It is a stressor for our students, and it does wear and tear on their mental well-being. If we want to talk about school safety, we need to talk about adequate class sizes. We need to talk about adequate learning environments. We need to talk about the staff that we would need to eliminate that provide the services for our teachers, whose number one job is instruction. And if we have to cut staff, we'll be cutting areas like social workers, school psychologists, counselors. They will be eliminated and no longer be able to provide the services to those students and the services for our teachers to instruct in classes, to make environments conducive for learning and environments conducive to working. Our teachers have a lot that they need to contend with to ensure the safety of our students. Let's work together to provide them the best possible environments we can. The more reductions we make on our budget, the larger class sizes we'll get, the larger the services will be eliminated. We talk about the numbers for special education. We're required to provide a free and appropriate public education. So no matter what would happen relative to the costs associated with funding our school budget, we would continue to have to teach reading, writing, math, social studies, science, requirements. We'd have to do that, no matter how large the class size would be, okay? All the other areas that we do to help mitigate special education costs in our intervention programs, through our interventionists, reading consultants, math specialists, these trained individuals who provide services in general education to help our children learn will have to be eliminated. We can't take the classroom teacher out. We're obligated to provide a public education. So if we cannot provide tiered intervention and services to our kids learning gaps will increase and referrals to special education will rise. When referrals to special education arises, I just pointed out to you guys the facts. We have the burden of proof on us. We either go into litigation with parents and pay costs of litigation to show that their child doesn't provide services, or provide them their services at a cost. Either way, something has to be funded. So when you look at the mayor's current proposal, and I am speaking with the mayor and hoping that we as a town, as a community, work together in the best interest of our city and our school system, as the mayor said in his proposal, to look at situations where this number can be increased. We need to look at the impact. I was asked by members of this table, what would it look like if we applied the mayor's proposal to our current budget? You will see at the bottom, it is a difference of negative $2,500,000. So we were asked, administration was asked, how would we make up $2,500,000? I showed you this particular chart for a reason. I told you that the majority of our funding is in staffing. So I'd like you to turn to page number 9 to show you how do we make up $2,500,000. Now I'm doing this not as a tactic. I'm not doing this as to scare anyone. As I said in the beginning, I was asked to present the facts, and these are facts. So when we do our budget, we utilize a standard position of what we call Master Step 3. Teachers are on a step system, and all teachers in the state of Connecticut have to obtain their masters. So when we're looking for an average cost of what staff would cost, we always state Master Step 3. You'll see in the top hand corner that a Master Step 3 is $63,000. That's the cost for Master Step 3. If we have to lay off staff, because that's the only where we're going to find money within a budget, we do have to accommodate for unemployment. You'll notice this, the numbers to the left. Talk about unemployment for a single family, unemployment for singles, unemployment for family. For a single individual, unemployment, the current unemployment rate is $703. Someone for a family is $778. That is guaranteed to them for 26 weeks. So now we have to use the law of averages. We don't know who we would lay off. We don't know if it would be someone with a family, someone who's single, and we're using, master step 3 as the average. So if we take 63,000 and do the average between a single or family, we'd have to account for unemployment costs at around 19,000. So for every person that we would lay off at an average cost of 63,000, we have to deduct 19,000 to unemployment. So we're only netting 43,000 per person. So now the average cost of laying off an employee is going to be about 43,000. So here's where the numbers come, folks. One person laid off is 43,000. 5 people laid off, 218,000. 10 people, 437,000. I was asked what would be the difference of the mayor's budget. The mayor's budget is approximately, the mayor's budget says that we would be around 2.5 million. If we were looking at a 2.5 million gap to mitigate the loss in that 2.5 million gap, you will notice at the bottom, that would be between 55 and 60 employees in the Shelton Public School System to make up 2.5 million. So those are our handouts in the general budget. Those, I hope, answer the questions that were asked of us. There's one last important point that I need to talk about that's outside of the general budget itself. And that is a separate handout that I just want to give the members of the board here. And although we talk about how to properly fund a school budget in the general budget, we also have to look at the commitment that the city makes in our capital projects, separate from the general budget. We have been very appreciative to work with the city to maintain our technology infrastructure, as well as the facilities in the building. They have all been done through capital projects and not part of the general budget. All right, but as we talked about the cost of the general budget, we must not forget the cost for the capital projects as well. Our building facilities are old. We need to keep up with the maintenance, as well as technology is consistently updating time and time again. I'm sure everyone at this table owns a cell phone. All right. I'm sure no one at this table has a cell phone that's over 14 years old. Okay. I'll give it to you, Mr. Inglis. You might have one 14 years old. Yet,
My brother-in-law.
in our schools, the city made an investment to put in Promethean boards. They are projection boards for learning in every single one of our classrooms. They are all over 14 years old. They are failing. They no longer project. They project blurry images. They project green pictures. And we cannot find a single part to replace these boards.
They don't make them.
They don't make them anymore. They are completely out of date. That is part of our technology budget, capital budget. It has been a part of our technology budget for several years. We've made some tough decisions to keep moving that forward, but I urge the city to not move that particular item any further forward. As well as in our elementary schools, we have our phone system. A key aspect when you talk about school safety, particularly at younger grades. Our phone system has been outdated for more than 15 years. They don't have the parts to replace phones as they're breaking down in our schools. We have to invest the money to replace the phones. Now, I know that the city has been absolutely wonderful in their ability to continue with our Chromebook replacement plan. And that is part of that technology budget. And I would assume, because we've been doing it for quite some time, that we'll continue to do the Chromebooks, and we will appreciate that. But we must not overlook the other high-priced items within this technology plan, as well as the facilities plans as well. Those are issues outside of the general budget, but I felt it necessary when I had the time today to speak to all of you to make sure that those were brought to your attention as well. That's all I have to say for tonight. I really appreciate all the time that you've given, and I appreciate all the hours that you all put forth in the positions you have. Last Board of Ed meeting, I recognized our board because it was Board of Education Appreciation Month. And as I said to them, I want to say to all of you, you are elected officials, you are volunteers. You volunteer for whatever reason because you believe in this city and you want the best for it, like I do, where I chose to live here. I want the best for this city as well. All right. 3 of my children went through the entire school system, K through 12, have all graduated from Shelton High School, as well as my wife, and are extremely proud of me. All right. I want the best for our school system. I want the best for our city. I appreciate every ounce of volunteer hours that you guys put in place to make that happen. And I continually want to work with all of you to make Shelton and the Shelton school system the best it can be. Thank you for all your time.
Okay, thank you very much, Mr. Saranage. Certainly, very well appreciated. And as I've heard you say several times, that the city is definitely been working very diligently along with you, and I'm sure that that will continue to happen. So let's move forward. The Board of A&T. All right, we'll start with Mr. Belden. Any questions? John Belden, do you have any questions for Mr. Saranage?
No, John. No, John.
Okay. John Boyko, do you have any questions for Mr. Saranage? John Boyko.
Yes, questions. I have questions.
Okay, go ahead with your questions.
I'll work by your page.
Okay.
Page 3. With the certified staff, is there an increase or decrease, and what is that number?
So that is the increase.
No, people, number of personnel.
No, there's no increase. That's the same number of people that we would have this year.
So we're not hiring or changing.
No,
Okay. On the tuition, does anyone pay Shelton inbound? Is anyone paying to be educated here?
no, because we don't offer any outside services to bring the students.
We don't
into
have
Shelton.
any magnet programs.
We have no magnet programs or anything to that. degree.
But we don't have people like broken families or something that the non-custodial parent wants their kid to be in Shelton, even though the kid doesn't officially reside here, and they're kind of tapping into our school system?
So by state law, you have to be a Shelton resident to attend Shelton schools. And so no one can,
Do we track that?
It's like 100%.
Absolutely.
If a child wants to attend, if a family wants to attend Shelton schools and do not have proof of residency, we do offer a tuition option
Okay.
that they can pay. No one has taken us up on that offer.
Okay. In utilities for electric, I think Sunnyside School has solar panels. Where is that reflected and how do we benefit from it?
That's part, so we have solar panels and that's a net expense. So what we do is we do have solar panels in the school system. We have a contract with also maintenance on that. What that does is it nets our bill. So let's just say our bill for the month is $1 and our solar panels create 2 cents of revenue. We'll end up paying 98 cents. So that flushes through that way. So it's a cost offset or a billing offset is the best way to think of the savings there.
Okay, should we offset that on other schools?
Well, that's a capital investment to look at things like that. A lot of that is also driven by the age of the roof. We would not put any solar panels on a roof that's say 5, 10, 15 years old, because that adds weight into the system and can also then further expedite the aging of the roof for something that's already that age. So that is a bigger, longer term conversation that probably needs to happen.
It should happen, definitely. The high school or somewhere, I believe we also have an energy cell. What's the story with that? How are we saving? And should we be dropping that into other schools?
That also is a good question. That is a CapEx investment. That'd be something to be discussed. It's the same sort of thing where we would have $1 expense for the month. Some of the fuel cell then would offset some of that cost. So it's a net when we pay our bills through the expenditure report.
So are we going to look into that for the future?
So we have been looking to the future, and just recently in the discussion that I had with the mayor has some ideas of how we can tap into that cell to help transportation costs. With the possibility of electric buses.
Okay. Yeah, that's right. Okay, we go down to staffing. What's the average class size of students to teacher?
So that's gonna depend based on grade level.
Okay,
I will tell you that currently in our K4s, we have 18 classes that are over 26 students.
okay. Moving to page 4, healthcare. For catastrophic costs, what is the option of insuring against catastrophic illness?
No, there's no pre-existing conditions anymore, so you have to insure.
Yeah,
You-
but
you
aren't
can't
there
eliminate-
options where if it becomes over a certain cap amount, you could buy a policy so you don't get hit with that big amount? It's some sort of overage cap, catastrophic.
That's
But
the-
that's the
that is-
175.
that's
the
what,
that's the-
Mr. Hiller was talking about, our catastrophic
So,
loss policy.
Can
We
we
do have that.
insure against that overage?
Yes,
One person at a time speaking, please, okay? So, John, if you're not through, then, then say so. Otherwise, let's kind of keep it, courteous here, if you will. All right, go ahead.
so we do have a policy over 175,000. That's our catastrophic loss policy. And Mr. Hiller, after I spoke about healthcare, Mr. Hiller talked about, because we have had so many catastrophic costs and conditions this year, over the last 3 years, our healthcare provider has lost money on our catastrophic illness costs. And that policy now is going to, what we pay for it is going to increase. Mr. Hiller talked about that. That policy is going to increase for the Board of Ed and the city of Shelton about, I think he said 25.5%. So we do have that insurance, but like everything else, it's going to increase because of the usage of our members.
Have we compared other healthcare plans to Cigna?
We have not this year, no. And we went to Cigna because the healthcare that we had was more, that's one of the reasons we changed to Cigna
Okay.
about 3 years ago.
Should we look into some comparisons in the future?
In the future, it's always appropriate to keep your options open, but that would be a decision of everyone at the table and with information and research from our healthcare consultant, Smith Brothers. So that wouldn't be a one-person decision.
If I could add to that, when we solicited bids on the stop loss policy, our broker advisor, Smith Brothers, who the city has utilized for a number of years, solicited bids on the stop loss policy from 18 different providers. One responded, and that was Cigna. And it basically is a result of the catastrophic pattern that we've had both with the city and the Board of Education over the past, what is now close to 4 years. And frankly, the increase, which is just over 25%, as Mrs. Panazzo indicates, was higher initially. They were up in the high 20s, and it came down through negotiation. And as far as looking at other providers, I think potentially next fall, because this would be a process that would take at least 6 months. And so we'd have to look at this potential next fall is if we're going to look at it and rely upon our advisor.
Okay. All right, moving on to page 8. What's the trend of our student population? Are we increasing or decreasing, and by what percent?
We are currently increasing. It is in the budget book, our last. Where it increased. As recorded when this budget book was posted, which was in January, the numbers were in January. We had a net increase from last year of 25 student increase from last year.
That's across elementary and high school?
Yep.
Okay. Yeah. You made a comment which I'm a bit confused at, so maybe you can elaborate. How does class size affect safety? You're gonna prevent someone from coming weaponized before they get into the class if we're talking some kind of safety. I don't understand how decreasing the class size is going to change safety.
So even in some of the most recent shootings that have happened nationally, the profile of some of these shooters have been their mental well-being have been into question. When we produce environments that are not conducive to learning, we're putting stress on our students and staff and their mental well-being. Our infrastructure in our schools, the class size, and I welcome you to come take a tour with me. Our classes weren't designed at a capacity to hold 30 students plus. So you're cramming students in, the noise level, their ability to work with others, the teacher's ability to work with the students themselves. We're talking about as a preventative measure to school violence, not as a reactionary measure. We're talking about making an environment where students feel safe and comfortable to work with one another and for teachers to be able to control the environment in a safe manner.
Okay. Page 10. We're talking about
Page 10, because page 9 is the last one.
or page 9. I'm sorry, page 9. We're talking about what it would cost for unemployment for teachers, whatever. My question, does anybody ever retire? Does anybody go to a different school system? Do we not ever lose someone where we're not having to pay unemployment and we just don't get to replace them?
So we've made significant cuts to our teaching force. Many of those cuts have been through retirements and through nutrition. When teachers do retire, we have reduced those positions. You will also find I think in the same page in the budget book, on page 20, you'll see a column that talks about positions elimination and the number of teaching positions that we've eliminated in the course of the years. So it's an unfortunate situation, but we've offered retirement incentive packages for our teachers. They've taken those retirement incentive packages, and what we've done to mitigate costs is we've then eliminated the positions altogether, which is contributing to larger class sizes.
So where would retirement incentive reflect in your budget over here? I didn't see any amount for that. Where would that fit in?
So that goes within the salary line items. So that's because if you understand when a teacher retires, because they're paid on a step system. So when you're at retirement, you're at a high level cost. So upon retirement, we would if we replace that teacher, we're either absorbing their cost by the elimination, or we're replacing, if it's a position that has to be replaced, at a lower step teacher. So then the net savings would help reflect in the retirement incentives of what we're doing for the staff themselves.
May I just add
Sure,
something
go ahead.
to your question, Mr. Boyko?
Sure.
So we would only pay unemployment, of course, if the teacher or the staff member we laid off did not get another job.
Correct.
If they, received another job, then those unemployment costs would go away, of course.
And reflected to that page 9, if a teacher did receive another job, the net savings would go up. We wouldn't have to account
Right.
for the 19,000, but we would still have to eliminate the position to get the cost savings.
Right. Okay, then on the final handout, something jumps out at me on the second page of it. Shelton High School, you're budgeting $375,000 for a boiler. I was the one who worked on the boiler project. We put in new boilers. What that happened to it? It couldn't even be 10 years old. What's going on over there?
So we currently have, and I don't have Mr. Calhoun with me to specifically address that, and I could get back to you on specifics, but we currently have 3 boilers at the high school.
That's correct.
2 of them which have been failing. Only one of them is currently working. The state of Connecticut did offer a boiler replacement program last year that we could take advantage of, but the city would have to take advantage of it with the cost savings, and we did not. So we want to make sure that we can at least get our second boiler back up so that the school will be functional, because we're only working off of 1 out of the 3.
Okay, we should be looking into, someone should look when they were put in, because I was involved with that project. A boiler is usually warranted more than 10 years. So maybe we should be looking as to why it's failing and see if we can't get some sort of rebate from the manufacturer or whatever, or a replacement.
So I absolutely will have Mr. Calhoun reach out to you to talk to you about more of the specifics, which I don't have here.
Okay. And I guess that ends my questioning. So moving on to the next person.
Okay, thank you very much, Mr. Boyko. Mr. Bragg, do you have any questions?
Of course.
Mr. Bragg?
You're running with you, John.
Just,
Jay.
moving some equipment around.
Huh?
Thank you very much for that, very in-depth, presentation. Just a couple of clarifications. The letter that was sent to, President Engles, projected on healthcare specifically, projected a $972,000 run rate over the next 5 months. Run rate is the average of the first 7 months of $7.7 million worth of healthcare costs. Is that correct? Yes.
Yes.
This letter is telling me then that there's a potential for some $4.5 to $5 million additional healthcare expenses for the year. Is that correct?
We expect things to continue to be fluid. We expect to see as healthcare changes month to month, week to week. Paul Hiller and I speak about this frequently.
Okay.
And sometimes going to the spring, things tailor off a bit.
Mm.
So as of the first 7 months, yes, we're running at 973 as part of the information from Smith Brothers was presented. So again, this is something we watch every week. We are hoping that we follow previous trends where things start to drop off. So I hesitate to take that number and multiply by 3 or 4 more. Because again, things are fluid, things do change. However, we will be overspent, no doubt, in health insurance. I believe the city health insurance line ended with every dollar spent in February. When I look at the analysis here for March, for us and the Board of Ed, we will also have fully spent everything. So to your point, we will definitely be over by a significant amount of health insurance as well as special ed. And that is why Mr. Saranich and I talked feverishly about this, putting this letter together.
Yep.
We presented to the Board of Ed and we wanted to make sure that President Engles and everybody in the Board of Aldermen knew what we're seeing, why we're seeing it, and to best present, especially from the expertise of the Smith Brothers and Cigna as to what we have occurred this year. Putting into a little bit more of what Mr. Pinozzo said, some of it has been a catch-up from the COVID pandemic era where people delayed, and there's been quite a bit more heavier healthcare insurance spend this year than what we've seen previously.
So that means then, so if we're going to be $8, $9, $10 million in healthcare this year potentially. That means the estimate for 2023, 2024 is also understated by some order of magnitude.
We're going into the new year. Just please know, when we look at the numbers and we start our budget, we only have roughly the first 3 months of the year, September, October, November, because we start working with all of the different departments as part of our budget process.
Okay. All right. Just moving on to one other item that I think I'm a little confused by. I thought there was a recent change at the level of the state regarding the excess cost grant, in that the state was going to start looking at the wealth characteristics of each city and only paying a sliding scale of the excess cost grant. Am I misunderstanding that this year?
You are not. They are looking into that, but no determinations have yet been finalized.
Okay, so right now we're assuming, as in prior years, that
any excess cost for special education would be fully funded by the state, and that would come back to the treasurer of the city. Is that correct?
Well, I want to correct that slightly. We are basing our calculations of excess costs on what the state has given to us in the past.
Okay,
The
okay.
state has not fully funded
Never
excess
fully
costs.
funded.
So we're using the calculations that we have gotten in past years.
All right, so let me sort of put this into a mosaic. This is what I'm seeing, and I want to be sure that I'm seeing this correctly. So we've got roughly $2.5 million that's underfunded with the current proposed budget that's on the table. From the mayor. We've got another potential couple of $1 million with the healthcare fund growth, correct? Potentially. We've got $6.8 million worth of federal grants that will evaporate, and all the momentum that you've built up in terms of developing support services and IT and all those good things that have resulted in 4 schools of distinction and progress towards graduation rates and all that good stuff. That's going to go away, and then the potential for higher sped costs because of the maybe change in cost grant. So you've got those sort of 4 things that are headwinds for right now for this budget, right? Am I understanding that correctly? Is that fair?
Yes.
Is that fair? And then when I look at your pie chart, which I'm very familiar to do a lot of these, you've got over 80% of the cost lies in basically staff and benefits, right? So you've got very little leverage in terms of being able to reduce expenses in other areas other than reducing staff. Is that correct?
Correct.
Okay. So if I take that one step further, when we reduce staff and we have as you said, lower level support for the teachers. I'm a teacher myself, so I understand what all that means. That's going to manifest itself in lower test scores, graduation rates, lower number of AP classes. The next generation overall rankings are going to go down. What's the timing between that? So when we take these these budget issues for 2023, 2024, when does it start to manifest itself with our children? That's my concern. When does it show up in terms of student success? Because that's our number one goal here, right? I mean, we're going to put 4,500 children through school. We want every one of them to be successful. How does this 4-part mosaic that I just laid out affect that?
Well, if I'm answering your question correctly in terms of you were asking for a timeline and the impact. Well, I'm just saying that impact would be immediate.
Okay.
I'm going to say that by state statute, we only have 180 days.
Right.
The Shelton Board of Ed added an extra day, so we have 181 days to educate students. Every single day counts.
Okay. Yeah. Okay. Done. Thank you.
Okay, thank you, Mr. Bragg. Mr. Nafik, are there any questions from you, sir?
Well, I have some concluding remarks and possibly.
Mr. Nafik?
Yes, I have.
He's answering, Jay.
I have some concluding remarks and possibly a question. The problem here seems to be essentially with funding for special ed. And the Board of Education can't be faulted for this problem. The resolution is the important thing with regard to this deficit problem. And I see 2 things that may be affected as per the outcome of the resolution of this problem. Either the mill rate is going to be affected and it's going to go up. Good luck with that. Or class size is going to go up, and that's an adverse thing. We have, if we just take the first grade and take elementary schools, you have 28 in these grades, and 21 is the ideal class size. So we do have some serious issues here. And the superintendent is apparently working with the mayor to try to resolve this situation. I hope that would continue. And if the superintendent has any comment on his working with the mayor to resolve this situation, that would be appreciated. But we do have a situation here, either class size goes up or the mill rate goes up. And the Board of Aldermen, of course, as well as the mayor, will be titularly involved in this because they are the fiscal authority and they make the financial decisions for the city of Shelton and for the Shelton Board of Education. And I would conclude at this point. Thank you.
Okay, thank you very much. I'm sorry, who do we have next? Mr. Fraser, if I'm correct?
Yes, hello. I don't really have anything to add. I think honestly, both Wayne and Joe summed it up pretty correctly. I'd love to know what the solution is to fill the gap this year and then how we're going to make that adjustment going forward because it's not currently there.
Okay. All right. Well, I think that, something I'm sure will happen, with the talks continuing between the Board of Education, the mayor, and the Board of Aldermen. So, I'm very encouraged by what they've been doing here in the very recent future. All right. Is anybody from the Board of Aldermen? Any questions from anybody at the Board of Aldermen? I guess we'll start with you first. Mr. Ingles.
Thank you, Ken.
Yeah, it's a.
Gotta stand up.
Okay,
Oh, he'll be right with you, Jay. Hang on, Jay.
roger that.
There was some microphones around.
Got it.
I thought this was a good overlay, a good discussion. I thought it pointed out some things that, as you just said, always, if you look in the mayor's presentation of his budget, there are always clues in there as to what he's thinking. You picked up on a couple of them. That's good. He did say that he thought there was some money somewhere around that we could maintain the teachers, the teaching staff. Remember?
I remember.
Yeah, I know you would miss that because I didn't miss it. But and also the fact that what's important going forward for this point. First of all, there's nothing is cast in stone. Nobody knows or has any idea. A whole bunch of us, we can't come up with an idea now and give you any idea where we're going. This business of people saying fully fund the Board of Education. That's BS. It means nothing. I don't know who said that, but look, here's the facts. We don't even know what the state's going to give us. And then after they tell us what they're going to do, and they put it into law, they don't fund it. Look at our special ed we get twice a year overruns, right? I mean, they're not fully. They say we got to do it, but they don't have to do it. So we got to keep the pressure on them, and that's important that they don't. But the good news is that they are, as Ken said, they are talking about it. They do have legislation on the table. They are going to increase. We got it as far as the governor that they're going to increase for all municipalities the education cost sharing grant, and that is a direct pass-through. We agree on that. That's a direct pass-through. That doesn't come to us. It doesn't come to us, and we don't decide whether or not to pass it on. When they pass it, you got it. So there are a number of other things. That we have to keep talking. I heard on the table, class size, and I only pick up on things. But I'm hearing from people, from parents. Our parents are telling me that their concerns rest not in class size, but in the number of people in the room, and the disruptions, and the learning environment is not conducive to their kids learning best learning opportunity. And I think this is something we ought to be talking about. That may or may not be about money. And if it is about money, it's all more important that we talk about it. But we don't talk about it just at budget time. We don't have enough time to understand it. We don't. You know what I mean? You guys know it. And, you know, and that's wonderful. But, and we trust you. But just so far. I mean, we have to talk. We have to understand it. But nevertheless, if you got students in the classroom, who's in the classroom? Students. You got the caretakers, the help the teachers, and any number of people. And it's just too many disruptions. That's the way I'm getting the message. Now, I went into the classroom once when Chris Fruit was here, and it was just a terrible learning experience. I feel sorry for anybody who had to stay through all that. And then when the signal went out, get up against the wall, and they had to find arm's way. But things like that, we got to take those things serious. I mean, you got what, six teachers you want to get hired on a grant?
577 is
Yeah.
gonna be 3 classroom teachers, 2 special ed teachers, social worker. I have the breakdown. 2 errors, yep.
As we worked last year, once we got away from the table and started really putting our heads together and coming up with ideas and solutions, then we knew more. You just don't know anything at this point. And that's why you don't make the final decisions until the end of May. But I think the important thing is to keep a positive attitude, positive working relationship, and, you know, understand the problems that you articulated here today are problems that are being every day, 180 days, you know, every day people are experiencing. So yes, keep it positive, and let's keep the mayor focused on this whole thing. Keep discussing with the mayor, keep talking, 3 of us, very important, very important.
Thank you.
Now, all these other notes, I'll save for when I see you individually.
Okay. You know where to find me.
Thank you.
Thank you.
Okay, thank you very much, Mr.
English.
Huh?
That was John English.
Okay. Yes, thank you very much, Mr. English. Anybody else from the Board of Aldermen have any questions?
Yeah, Jay, Eric McPherson.
Okay, Eric, go ahead.
Just, yeah, I want to go to page 1 on the presentation. Is this the COVID money that we're talking about, or is this other separate?
No, it was money as a result of, it was all encompassing,
Okay.
it had different titles, you know, people
Yeah.
associate it as the COVID money, correct?
And that's just about expended, or it's.
So we're working off this final grant, which is the ARP grant, ESSER 1, ESSER 2 spent. The APR grants, the majority of it is gone. The remaining balance is where you get those read out numbers of this.
Yeah.
We're gonna put that money towards next year's budget,
Okay.
to try to lower the total cost in our request.
Yeah, you said that next year we'll.
And next year, we'll talk about that again next year. Yeah.
We'll talk about that, right, okay. I just wanted to go on to page 5. Last month's full board meeting, we did have many people come and many did speak about the class sizes. Is this in all of the schools, elementary, middle school, or intermediate and high school? Is this throughout the school system?
So you're referring to page 5, you're asking the special ed situation or the class size?
Well, the class size, then I just want to talk about that, but I just wondering, I just trying to gauge, is it all of the schools that we're talking about, the class size?
So it varies from school to school, grade to grade. There are certain grades that are larger than others.
Right.
One particular across the board in all of our elementary schools, 4th grade is a very large class. Our current 8th grade is an extremely large class. So these are where you're seeing some very, very high numbers. But of course, they're gonna move on to different areas.
Right, so it may.
And as some of these figures indicate, we have students who are consistently moving into Shelton, so the numbers fluctuate.
Yeah. Matter of fact, staying on page 5, seeing the numbers, how some have moved out of the special ed, and then we see the amount that are coming in. You said something that I really caught my curiosity, is that New York State and Massachusetts, where they require the parent to provide the burden of proof, and then here we have Connecticut, and it's the opposite. And I said to myself, it'd be nice to do some research into this as to what their thinking was when they put the burden of proof on our school system, not just here in Shelton, but throughout the entire state. I can't understand the reasoning or whatever they want to call it, because they pass these horrific mandates, and I sympathize because it's a dramatic impact for our system and throughout Connecticut, and I think it's just very unfair for the amount of burden that it really puts on us. And it does, like I said, I think it takes it takes from some, others may benefit, and then you said that with the students that were dismissed from that. You touched a little bit on who exactly does that evaluation, and now the state doesn't play a part in that, does it?
They do not. It's all done at the team level.
Okay.
So what happens, every child who receives special ed services gets assigned a case manager.
Yeah.
That's one of our staff members. It could be a special ed teacher, it could be a school psychologist, it could be whomever. We try to be equitable in terms of our case assignments. They're in charge of tracking the child's data. They're the person who calls the PPT, invites the parents in, they review the program. And then as a result of the team meeting that takes place, the determination would be made whether the child is eligible for dismissal.
Okay.
How do you measure student progress?
That's a pretty broad question in certain ways. We measure in all different ways. So, I mean, we of course have our own assessments that we provide. We have district assessments. I mean, we have curricular assessments. We survey students, we survey parents, we look at data and achievement data and how we're doing.
Testing procedure.
The state has a standardized testing procedure. We have one as well. We have district tests called the NWA test, which aligns to the state assessments. So we can measure progress in we administer it 3 times a year to track a student's progress. And it's a predictor of how we believe they're going to perform on the state accountability measure.
So you should be able to see that the students are progressing according to some standard.
Oh, absolutely. And then we report out on that progress and standards at a Board of Education subcommittee meeting. We have a subcommittee called Teaching and Learning where we do that. I will absolutely send you an invitation at the next meeting that we do that, where you can come join us and you can take a look at our progress.
I will come.
Okay.
And
You just asked what was going to be my next question. Yeah, well, no, hey, but that's okay, appreciate the explanation. I certainly do. Let's see. So, okay, so we talked about that. So I don't have anything further yet, but maybe later on value to see any of the other arguments. Thank you for the presentation.
Yeah, thank you for the great presentation and the.
Chris, get a
additional
microphone.
information. Most of the people, okay, do you need me?
Jay, Chris.
Are
Chris-
you finished, Mr. McPherson?
Hey Jay, it's Chris. I'm gonna talk now. So again, thank you for. the
All right, go ahead.
And most of the questions have already been answered for me, so I'm going to focus more on the healthcare cost. And I want clarification from probably Paul Hiller or Todd perhaps. Catastrophic costs, when you say per case, one individual can then have more than one catastrophic cost, correct?
Yes,
Okay, are we currently having that crisis with some of our people? Just curious.
not in the ones that we reviewed on that during the February meeting. I'm sorry. Not in the ones that we saw in the February 8th, 2023 meeting. The catastrophic costs we saw were one per individual, whether that was the employee, a spouse, or a dependent.
Okay, thank you. Also, we have a wellness coach or coordinator. Do they interact with the navigator at Cigna? And do they do any form of crediting, which really wouldn't help us as far as cost, but it would help the individual with their deductible, with a motivation to go see the doctor on a more frequent basis for screenings. And some insurance companies do that to mitigate the deductible, the large deductible that an employee has to pay.
So the wellness coach is an employee of Cigna.
Oh, okay.
And we have a meeting scheduled every month to review the progress with the Cigna team, as well as sometimes our healthcare consultant joins that meeting as well. And so we review what the initiatives will be. We're currently going to explore an initiative of providing the portable colorectal cancer, again, on a voluntary basis, but that's one of the initiatives we're exploring.
So I'll segue to that because I did have a question on cessation programs, screening programs, all of those things would mitigate potential catastrophic illnesses.
Yes.
And that needs to be promoted. I know as a clinician myself, many employees are hesitant to have their healthcare information disseminated, if you will. They're paranoid about that, and I understand that's a hesitancy. So are there any wellness campaigns? We've done, when I worked in the corporate sector, we would do memos on site. We would try and encourage things like that to get people, again, these are all things that would mitigate medical costs, their cost containment initiatives that do work, and you save lives. We did that when I worked at Sikorsky, when I first moved back to Connecticut. We saved 10 lives of two women had stage 4 breast cancer, and they had never had a mammogram in their life. We did them on site. So there's things like that Cigna, and again, what John Boyko did mention about, have you entertained looking at other insurance companies? I know Aetna and United Healthcare, they have some other great programs, but Cigna traditionally is the lowest in the state. But that may change, so it would behoove you to look into that. One last thing I'll just bring up, and again, I'm focused on this because you can save a lot of money in this. What about the medications? Are we in a, do we subscribe to mail order? Do they do anything cost savings?
Yes.
Okay.
Yes.
So they do that.
And we encourage our employees to go to the pharmacies that we know are charging less. Among those would be Costco, CVS, Walmart. Yes.
Okay, so usually an insurance company will have a network, though. If you use that network, it will even be lower.
Yes, we do employ that. Yes, there's a in-network cost, and then if you go out of network, your costs rise. Yes, that's in all of our contracts.
Okay, and I think I had one more question, but I can't read my own writing. So I think that's it. Thank you.
Thank you.
Okay, anybody else from the Board of Aldermen have any questions?
I just have a couple of Bernie Simons.
Is there anybody else?
Bernie's gonna talk now, Jay.
No?
Oh, yes.
Okay,
yes.
if there,
Bernie.
Okay, we all.
say again?
Oh, my God. Okay. Sit back and we'll get this over with quickly. I have a couple of questions.
One of the questions pertains to, when we talked earlier about the boards they have to replace.
Great,
Yes. And also the telephone systems. Do you have any estimates on what kind of numbers you're looking at on that?
So if you look at the technology capital plan, there are estimates that are put down there, but we do have to say that that plan was put forth several months ago. And some of these costs fluctuate.
Sure, absolutely.
Very frequently, so, what can I say? So, interactive displays to do 360 students, it would be a little bit over $1 million.
How about the phone system?
And the phone system is not in this page. Is it in the other?
It's 92.
That's it.
It's the top one, right?
Is that all the
Oh,
schools?
it's the top one, I'm sorry.
It's in the
Yeah,
first year.
93,000.
That's all the schools? All,
No,
all
those would
five?
just be all five, yes.
Five,
The
thank you.
5K.
The 5 elementaries.
The cost for telephones are completely. As it used to be. Got an existing.
Well, I got a couple of this. One thing that I kind of wanted to point out too, I know we talked about the amount of money we spend per pupil, that always seems to come up as a big discussion point. And we have approximately 4,600 students, round numbers. My understanding is that our current bus contract is approximately $3.5 million.
That is correct.
Okay, and I understand that surrounding districts similar to ours are 5 million plus. And is my understanding also that's also included in the cost of what we spend per student, is that correct?
That goes in, that's all we spend, including in-kind services, all gets rolled up into the annual EFS report. That goes up into the state database, and so then those numbers fall from there. That becomes part of the municipal fiscal indicators report, and that's where I put in the book every year, and I reference that final document. That's state public.
Okay, so then my understanding is that when we're showing that our students really, there's approximately a little over $300 a student extra that doesn't show because we have a cost savings on the busing. So it's just, I just bring that up because, you know, it always comes up as an issue because it's hard to show that we have a bonus that, you know, it's not the kids are getting cheated, but the system is actually benefiting. And I just wanted to bring that up just as something that I want to make sure I was correct in my assessment on that. But other than that, I was interested in those things predominantly. They gave a great presentation. Thank you for your time today. And Chris has a question.
I do. I'm sorry, I have one more question. With regard to behavioral issues such as with special ed children, I had looked it up earlier and I just pulled it up again. Autistic, behavioral issues, whether it's in the school or outside of the school. The state of Connecticut allows medical insurance, behavioral therapy services limited to $50,000 annually for a child under 9, $35,000 for a child between the age of 9 and 13, and $25,000 between a child between 13 and 15. And I know I brought this up last year. That has there been any discussion with the with this is where it's hard because students aren't employees, but I mean, the majority of people have health insurance. So is there any way to integrate what their benefits are on the outside with what, you know, to coordinate to benefit the student to get the right care? Because we are taxed with not being able to provide all the funding all the time. I just, if that's available, I don't understand. And maybe parents are using it.
So are you speaking about Medicaid?
No,
Medicaid?
No, this is private insurance. I had looked it up last week and I pulled it up. Yeah, so it's saying it's part of your, as a clinician, if I had a child that I thought needed behavioral care and stuff, the first thing I ask is I don't ask about a school. I ask about what kind of medical coverage they have and you look into that. So most healthcare benefits do incorporate that into some form of treatment. So I would hope that some children in the school system that do have, it could be anything, it could be government programs, it could be private insurance. So I'm just wondering, has anyone thought to look to that in detail to help a student? That's what it's all about.
So the school district would not be able to initiate that because of HIPAA.
Correct.
I'm sorry, because of FERPA, because students have privacy. So their health insurance would have to be initiated by the parent. Is that what you're referring to?
I am, but I think there needs to be some kind of partnership with the parents and the school, et cetera. If you integrate both the benefits from special ed and what we can help them with, in addition to what I know, look, as a clinician, HIPAA, I get it all. But if you truly want to help someone, why would you not want to integrate whatever benefits this child may be entitled to?
So, I would have to discuss that with probably our pupil services staff. They may know more about that,
Yeah,
certainly than I
curious.
would. I don't know, Mr. Sironich, if you
That's a
want
lot
to tackle that.
Thank you.
Thank you.
I have one last question, and this is both for knowledge and maybe a little naiveness on my part. I know that the state has programs that we benefit from, like heating oil, where you get on a contract with the state and we ride their coattails in on that because it's a mass purchase. Does the state, or has it ever been considered? I know the state uses several insurance companies. I know they use Aetna, Anthem, United. They have like 4 healthcare companies that they work with all the time for state employees. Has there been any discussions whatsoever, or any programs available where the school systems could go on to a buying program similar to what the state offers for other things like heating oil, gasoline, et cetera, for the school systems as well as the city of Shelton, where, if for lack of another term, volume purchase with the population so much increase to mitigate the cost over a larger population. Does anything like that even exist?
So just to answer your question about the state medical program, so that was one of the options we considered when we went from Anthem Blue Shield to Cigna, and the state program was the most expensive that we saw. It was the most expensive because the state programs then, and this is going back about 3 years ago, they were not high deductible healthcare plans, and they were packed with a lot of benefits that we simply could not afford. As to the other question about purchasing, I'm not familiar with any purchasing. I guess they would be conglomerates, if that's what you're referring to. Maybe Todd could answer that.
I was just making an analogy, that's all, that, like they offer different items that, that are used commonly, that I just thought that maybe over a larger population, the insurance could have been a lower cost for us.
From what I've seen, most of the state purchasing is for hard goods.
That's what I've seen too. I just, like I said, I was just wrong about for education. Thank you, that's the end of my question.
All right, so Kevin Costi, I'll ask my questions now. I think I'm next in order. The health insurance, we use the city uses the same provider for administrator and advisor for health insurance. Does that mean we're getting a group rate between the city employees and the school system employees?
So it's one plan, Cigna, and then our health consultants are the same. The plan design is different for Board of Ed and city, is my understanding. So our plan designs and how we pay for our medical insurance is different.
Okay,
So for example, when I refer to plan design, Board of Ed employees have what's called a high deductible healthcare plan with a health savings account. So Board of Ed employees have to meet a deductible before their insurance kicks in.
right,
The city's plan designs are different than that.
they're different. Okay,
Yes.
okay. So
If I could just add to that, and we will discuss this next Tuesday night, at the next hearing with employee benefits. But Carol is correct, and there are significant differences between both the Board of Education and the city. And actually within the city plan, there's a difference with the police department and the rest of the city. So I mean, there's the one thing that's consistent is that it's with Cigna. And the numbers stay the same as far as the stop loss policy is concerned.
Okay, but and is there any particular reason we can't merge those more and possibly get a bigger savings per person covered?
I think one of the issues there is you're dealing with, I don't have the exact number, but probably close to 11 different bargaining units between the city and the Board of Education. Their contracts expire at different dates, and that's one of the obstacles that makes it difficult to bring them all together into one. Let's say that way.
Right. Speaking of contracts, I was going to ask, like, how many years are on the contract for the health insurance provider and for the catastrophic cost increment plan?
It basically would continue through June of next year, June of 24. And as I mentioned earlier, I think it's time, particularly this fall, because this doesn't happen in 3 months or so, that we really go out and have our consultant, our advisor, Smith Brothers, basically rebid it and see what's out there and what our options are. And then we would have opportunity during the winter months, right after the holidays, say, to really evaluate what proposals come in.
Okay, so like the cost on the catastrophic cost could go up again next year.
Well, it's as I said earlier, we locked into a cost, and the stop loss policy is going up just over 25%, 25.16%. There is also, for both the city and the Board of Ed, there's what's called an aggregate stop loss policy, which if everything went way up total, not individual, but that would be covered under this stop loss policy. That particular policy had no change, and that's if we did 120% of what their estimates are. But we're not at that point, but we're over 100%, let's say, as to where they are, but we're not up at the 120 level.
Okay. I believe Wayne asked before, how, for some sort of estimate of what the overage for this year might be. I know it might be the money we spend for the next couple of months will hopefully be less than we've done through the previous months of the year. But do we have an estimate of how much that difference typically is for the next few months?
So starting in March, as I did last year, I'll be doing it. So starting in March, which we just finished, part of my analysis is we'll start doing a projection. And so in the last few months of the year, I start to go through every part of the budget to see where we are going to better land. And then, of course, as we get closer to the end of the year, as numbers become more accurate, that final part comes together. So for example, last year, 3 months in to the end of the year, it looked like we're going to have an overage of minus 299 and change. The good thing is doing everything we could to make sure we had all parts and pieces of our budget put together. We ended at minus 139. So as of right now, as I start going through, I will be putting that into my projection, and then we'll make sure to keep you updated as we progress.
I was just wondering what the ballpark was right now.
Things are still very much fluid, so I hesitate to give you a number.
All right, so we don't have one. Okay. And then on workers' compensation, I don't think we discussed this yet. I see there's a line item here for 500,000 in the proposed budget, and then but then on the mayor's proposal, there's expenditures on a separate line item for workman's compensation under the Board of Education for 250,000. That's zeroed out for next year. Do we know why that got zeroed out?
Can I touch on that, please? The mayor last year, the Board of Ed has, and one thing that should realize is that workers' compensation can be a very erratic line item. There were several years going back 8 or 10 years ago where the Board of Ed had significant payments that were made. And they were budgeting underneath what the amount was. What the mayor did last year, that $250,000 line, he wanted to isolate it out of the Board of Education budget so that the Board of Education didn't have control over it, frankly. Once we go into the budget of 75 million under state statute 10-222, the Board of Ed controls that totally. What the mayor wanted to do is to separate those funds, that $250,000 out of their budget. And that is, I think it's a discussion in the coming weeks with the mayor as to where we are. I don't have figures. I can get them as to what our year-to-date numbers are on workers' comp. But that was the question. The Board of Ed kind of merged those numbers. And Ken, Todd, and I had discussions on this in the past 2 weeks as to it, because the first theory was the mayor was giving an addition of $2.5 million to the budget, and then they said, well, it was 2.25, and that 250 became an issue. But I think that's, again, to be discussed as we go down this path on this year's budget. And to get an update as to what our year-to-date expenditures have been as far as workers' comp, where we are.
Right, on the budget proposal, it says year-to-date expenditures is exactly 250,000, which seems very unusual to me. But,
yeah, and I will get for Tuesday night's meeting, I will get an update as to where we are year-to-date as far as that's concerned. Again, our policy on workers' comp, we do have a stop-loss policy there, but we're self-insured on that up to $700,000. And there have been claims that have exceeded that $700,000 that we're still paying out on. And the liability on it, which shows up in the annual audit report, is really a 20-year liability. What the actuaries believe will be the costs that we would incur because of existing plans and potential plans, potential claims, that is. Rather.
Okay, is it normal?
I'll get an update as to what our year-to-date numbers are for Tuesday night.
Is it normal to isolate that out from the Board of Ed budget? I mean,
it was no, it wasn't. It was something that the mayor wanted to do for the current year, and so when the budget was adopted last May, that was broken out.
Just as like an experiment, or
perhaps I don't know. I don't want to be accused of what the theory was on it, but it's it could continue, or it could be included within either budget. Right now, it's really that 250 is essentially within the city budget, or it's under the control of the city.
right? And then let's see, on the expenditures year to date. Yeah, on the expenditures year to date on the Board of Ed side also has $500,000 exactly spent for that year to date.
So what we do, same thing with the bus contract. If you look down the bus line item, we went from 250,000 a year ago to this current budget of 500,000 for workers' comp. Likewise, we were 3.15 million for the city bus contract last year. We're 3.15 million this year. What we do is, from an accounting, books, and records perspective, we work off of one system. He works off different, but we basically do inter-district journal entry. So the money comes to us, and then it goes back to be spent to cover any sort of worker comp bills. So it's a journal entry. And so Paul and I worked together that back roughly October. We did it right away, so that way things were clear and clean for everybody for future conversations.
Okay, so this isn't actually expenditures, it's just we pay this much and everything's covered, and we don't get any saving, there's no potential savings there.
In this case, we have 500 in this budget, so we go through, do a journal entry right back to the city. So it's
Okay.
kind of how it works from books and records perspective.
Okay, so there's no opportunity for savings there then. Right, okay, but, the other question I had about that 250,000 being under the Board of Ed budget as a separate line item. I know it's state law that you can't take away, give a lower amount to the Board of Ed. Does having that on a separate line item cause us any legal issues if we zero it out for next year?
Again, I think that's a decision, over the next 6 weeks or whenever we have as far as to do it as to where we are. And also to get an update as to what our year-to-date expenditures have been.
Right.
I've got to get that. I don't have that.
Worried about the expenditures. I'm just worried, you can't fund the Board of Ed at a lower amount. And of course, we're not, because we're proposing, 77 as opposed to 75, but does having separate line items make a mess of the issue in terms of the legality is what I was asking.
Well, so that's why we would look at the allocation that we received as 2,250,000, because we can't include the other 250 because it wasn't allocated to us.
Wasn't allocated.
Well, it gets grouped together. Well, maybe that doesn't count as allocation.
No, on
That's
our
kind of-
records,
that's kind of what it
we
was
wouldn't
asked.
reflect the 250. So we
Okay.
can't reflect the 250. So
All right.
If it stayed at 250, going into the fiscal year, new year, when I put and operationalize it in the budget in units,
Mhm.
my workers' comp line will be 250,000,
Right,
not 500. That's in there this year.
okay. Let's see, on the student transportation part of the city budget, I noticed that field trips and athletic transportation was also zeroed out as line items. I was wondering why that happened.
And what was done there, if I could add that, was basically the lines for athletic transportation and field trips were added into the 3,150,000, because if you look at that line, as far as the proposal is concerned, it goes up by roughly
It goes up to 300 or 3,275,000 from 3.15, the 3.275. But if we're rolling that up, I mean, don't we want to know how that split is? I mean, for keeping track of it on the city side, where we're spending it.
The Board of Ed actually pays for that. We're spending the money as far as the vehicles and the labor cost as far as the.
Well, wait, I thought we were still charging the Board of Ed 3.15. If we're putting into the budget on the city side 3.275, does that mean we're gonna actually charge them 3.275?
They're paying the 3,150,000 as far as which was been the contract since.
So we're planning on spending
fourth
more.
year into it now, and the additional charge is for the additional add-on there was an estimate as far as what costs we would incur for athletic transportation and field trips.
But we do have field trips when you have athletic trips.
Right, we haven't canceled them. Yeah, I was getting it. That's kind of what I was getting at, but also just wondering if that was just a.
it was
a mistake
communicated to
zero
us
out.
that we're gonna keep the line item the same on our side at the 3,150,000. What you're referring to is the city side. We can't speak to that. I mean, that's a question that Paul has to, answer.
Right,
I anticipated keeping field trips and athletic transportation the same, and either units, my increase isn't for our books and records, so we 3.15 for the city bus, and then field trips another dollar amount, the athletic transport another dollar amount. That's I was looking at it the same year over year.
okay, so we rolled it into ours, but looking at it as the same. But we're not we're not charging, why would it be on your budget if we're not charging you for it?
No, that's not, we're not charging. We're still doing the 3,150,000. That's a separate.
Yeah, 3.15 is the same number year over year, just like in the financial walk, there's no change. Paul and I have talked about that, so we're staying at 3.15 for the city funds.
Okay, because I do see that field trips and public transportation's on the revenue on the city side too. Like, if we're not charging you for it, then how are we getting revenue for field trips and athletic transport?
Can't answer that question.
Okay, so that'll have to be something that's followed at a different meeting. Okay.
The city has a revenue line for the athletic transportation and the field trips.
Right, yeah, I was wondering, I mean, if we're not charging people for that separately, how are we getting any revenue from that?
It is being charged. It is being charged separately outside, over and above the 3,150,000.
Oh, so do we charge? Oh, that isn't charged to the BOE though?
I'm sorry?
That's not charged to the BOE, the Board of Education?
Yes, they're paying for the athletic, it's primarily for the athletic transportation for the high school.
Well, they look very confused by that, like they don't know that they're paying for it.
It's not included within the 3,150,000.
So, and so am I correct that that's not in your planned budget is the pay for that 125,500?
We have not planned to increase. We were told to keep the 3,150. That's what we budgeted for.
Okay, but I mean, if this is correct, that we're gonna charge you for, that the city's gonna charge you for field trips and transport, that's another 125,000 you need to worry about on your budget.
If we aren't being charged for, which we weren't told of that, so. I can't speak to that. All I know is that the cost that we were given for transportation.
All right, so we'll have to confirm that with Paul on Tuesday's meeting, I guess that's A&T should ask that, right?
If you look in the budget book, there's a line at the bottom of, I don't know what page it is, for athletic transportation of 95,000. And also another line for student field trips of 2,500.
Okay, so it is in there. Yeah, I see it now. I got that in front of me. But that would be short by over 20.
Short by about 30,000 roughly.
Yeah, roughly.
Maybe 25 to 30.
Okay. Yeah, I think we got to follow up all at a later meeting. Let's see, and this might just be me being new, but this because I've only been an alderman for a month now. The capital outlay plan, you mentioned that's not in the regular budget, so is that not in your request for $80 million? Is this something separate?
That is not part of the $80 million request. That has been funded separately. I can't speak to how the city funds that.
So this is an extra request to us.
The city funds it. They
Right,
don't
right.
fund it at all.
Yeah,
They don't have a capital budget.
Got it. Yeah, that's just,
Yep. Yes.
I told you that's probably a question just for me being new.
Nope, it's a.
Okay. Yeah. All right, I think that exhausts my questions.
Okay, thank you.
Thank you. Kim, so give another 2 hours.
Oh, no. All right, so is there anybody else from the Board of Aldermen that would like to speak?
Alderman, just a couple questions for Ken. Like I said, I do have pages of notes, and hopefully someday I can go over those with you and ask you questions instead of keeping everybody here forever. But I do have a couple of things I do want to ask. You mentioned about these grants that are expiring. Are there more grants that you could be going after or should be going after?
We applied for every possible grant that is offered to the school system.
And you'll continue to do that to hopefully replace some of these grants that are.
Well, it won't replace this amount of money. We have already, so the operations of the school system exceeds the 75 million that we currently do. There are already and have been staff and equipment and programs that have already been supplemented on grants that we apply for annually.
Okay.
Many of those are done through title endowment grants through the state and federal government. We'll continue to look for those. A lot of the other new grants that come down are replacement cost grants where, for instance, the newest one is a security upgraded grant that we're working with the city. But that would be that the city would have to pay for the costs associated with the security up grants, and they would get a reimbursement of 42%. We're actively looking on that and putting that together, but nothing of this magnitude that was involved with the ESSER money is available to us.
Okay. On page 5 with the sped question,
And this is an issue I discussed with you last year. And again, I want to bring it up this year. My bigger question is not how the expenses work and all this. What are you doing as a superintendent to work with the state or state representatives or any other superintendents, any associations you're with about reversing this program? Eric mentioned this a little bit before, how New York, Massachusetts, the burden is on the parent versus the city or the Board of Ed. Are you actively working to change this?
The simplest answer to your question is yes. Burden of proof has been associated in Connecticut as long as I've been in education. I'm gonna refer to Carol, who's been in education longer than I have.
Too long.
Okay. So this has been something that's been in the state that even predates my employment as an educator. But I am, as a superintendent, I am a part of an association called CAPS. It's the Connecticut Association of Public School Superintendents. We have a comprehensive plan that we designed and presented to the state of Connecticut that addresses many issues, including the idea of fully funding excess costs, as well as reversing some of the legislation that, and if you'd like a copy of the plan, I have many copies that I can provide.
And are you making progress with that?
So CAPS, like any other association, has lobbyists, and we have lobbyists that work at the Capitol at their best effort. I can't speak personally in terms of what progress our lobbyists have made towards this. This will all be decided when the legislation votes.
Okay. And just one last thing. And I think John referred to this before on metrics and how you gauge the success or failure of the system. Certain people make speeches and say that we're failing and going down. Meanwhile, you have stats here that 4 out of 5 schools are recognized as schools of distinction. We're fully NEASC accredited and things like this. So it sounds like we're getting better. Meanwhile, people are saying that we're getting worse. So are there metrics that we could judge, like this year versus next year versus the next year, of how can we set a baseline and say, okay, now we are actually going up or we're actually going down, and so we can measure that?
So again, the short answer is yes. It continuously happens. We have accountability measures that we have to do annually. There was an offset the past 2 years because when the pandemic took place, the state subsequently canceled any type of accountability assessments and such. We did our own local testing to our best of our ability, but even at that time, the state did allow students to opt out of testing and to remain home. So even the data that we accumulated at that time would be accurate. So there's really basically a 2-year gap that we're building upon. We're going to continue and pick up from the work we did pre-2019 to continually use those measures. As I said earlier, yes, I'm extremely proud of our school system. We are doing exceptionally well, but we can do better.
So what metric, if we were to have a metric that we said, here's our baseline for this year, for 2023.
Well, I think right now,
when we revisit this, we say, okay, we improved her.
So the metrics that I presented today are the things that all public schools in Connecticut are evaluated by. So there's a standardized, what they call the Connecticut State Report Card, that has 27 comprehensive categories, including performance on standardized tests, graduation rates, what are we doing in terms of, and I'll give you the list, but how are we providing enriching programs for our students? Attendance rates on students, all these different metrics are what we as a school system evaluate ourselves and measure every year annually. It gets broken down at the district level, it gets broken down at the school level.
That's how we do
it. I am concerned in our ability to continue to maintain progress if we have to make substantial cuts to the school system next year.
Thank you. That's all. Thank you.
You're welcome.
Okay, it's Anthony Simonetti from the Board of Aldermen. Thank you again for the great presentation. I think the audience deserves a round of applause. They've sat there very quietly. Thank you, everybody who came tonight. My question is, I don't see an actual number for what we spend on special education teachers? Do you have a number or breakout of that? I see the certified teacher salaries at 34,380.
They would be included in that number.
They're in that
That's
number.
all
please?
certified teachers.
Okay, the other thing is professional service for special ed. I'm gonna guess that's tell me if I'm right or wrong. OT, PT, ST, psych,
Yes.
psychologist.
Yeah.
Okay,
Psychologists would be in the teacher line.
okay, the psychologist and teacher, thank you. The other question, it's a larger number. You answer the questions on the student transport, special ed transport. I see substitutes. So a daily substitute, 25,000, I don't see any problem there. Certified tutors, where are the certified tutors fill in for teachers or?
You want me to-
Go ahead, you can answer.
So tutors are part of our intervention program and they take small group. They perform small group instruction of students and they aid the teachers in the classroom. So they're not substitutes.
Okay, building substitutes are like, is there one per building or a couple for the high school or?
So there's a total of 26 and it's based on teacher enrollment in the school. So Shelton High School, which would have the most teachers, would have the most building subs.
What is a long-term sub?
So a long-term sub, the state of Connecticut, the Department of Education requires after 40 consecutive days of an absence of a teacher. So a teacher goes out on a family and medical leave to say have a baby. We are required by the State Department of Ed to place a certified substitute in that position. And they are paid at the bachelor's rate, bachelor's step 1. So they're the most costly subs and we're lucky to have them because again, we are required by the state to provide that service.
And to the electricity, which is 5411. I know that, as we said, some of the classes, some of the schools have the electrical, the rooftop solar panels. Is there a rebate that the state, that you get back from the electric company for the school system itself?
So just the way to think of the solar panels is if we were to produce some.
No, that I understand, but do you get a rebate of any kind from the electric company?
Only for a period of time.
Okay, that's good. Thank you very much. I'm finished. Thank you very much for your help. Thank you, Jay.
Can I ask?
All right, you're quite welcome. All right, go ahead with the one more question.
Okay, the pay to play reimbursement, on the city expenditures, I see only $229 for expenditures on reimbursing parents for pay to participate. Is that all that the UE has collected from parents for pay to participate?
So it's current year we're in my report out, when you see my financial report out. We're very pleased and very thankful for the Board of Aldermen that there was a allotment of $250,000.
Right.
What happened was when that was made, we already started partly collecting for fall, nothing for winter spring sports. So the parents that paid in that amount for the fall were reimbursed by the city. And then the remaining portion was then we used to buy equipment, shirt.
So the parents don't have to pay and get reimbursed for the spring, only in the fall.
There was no,
Yes.
The mayor took it out.
Right. I just, the year-to-date expenditure is listed as just 229, so I was just, it seems way too low. I'm just wondering how we accounted for that. Well, I guess that's probably a question for Paul, how we counted that on the city side. Do you know how much the Board of Ed's gotten from us, the whole 250,000 or? portion of
I
it?
believe at the end of February, my report out, we had spent all 250,000.
Okay.
And we're counting on that again for the new year.
Right, which has me concerned because that's also a zero in the mayor's proposed budget this year. So we'll have to work on that because if we don't allocate for it, we know we're going to get it.
Thank you.
Right.
Did you, a general question? Last year.
Hold on, Jay.
Keeping track of transfers throughout the year.
Budget transfer.
Yeah, Was that done?
So you'll see in my monthly expenditure report, there's 3 columns. And I have been asked this for the last couple of weeks. We have made no budget transfers this fiscal year. So what was allotted for on day 1 is still currently allotted for now. Welcome.
Can I just have another question?
Push the button.
Your time.
Okay.
Yes, your time. Okay. There's no page number to it, but the object number, the line number, 5230, other retirement benefits. Can you kind of elaborate on that a little bit? In the budget book, in our budget? Yeah, it's in your book here. There's no page number per se, but it's in section 3. The number's 811 and change.
This is this one here, 1.4.
Thank you. 811,000.
Yeah, if you could just kind of highlight.
So those are when our teachers retire and other staff retire in their contracts. They have what's called a severance for unused sick time. So that would be one of the benefits that we pay out. That would be included in that line. And then I would say in the last 5 years, we've offered retirement incentives to our teachers. So that would be the line that would include those retirement incentive costs, as well as sick pay severance.
Just going forward to like next year when you do it, I'm not, if you can like, instead of just labeling it like that.
Thank
If
you.
you could break it down as the way Carol had described it, it's just much better to read it that way. If you can do that. And then just one last comment, going through the page where it's in section 2 towards the end, but it's the section where all the cities and towns are listed per pupil spending. I see we're similar to several other towns in there, but I think though this really doesn't reflect like the when we cover the pay to play or the laptops and stuff like that. Because wouldn't those types of things bring that number up more, so it would reflect us more with some of these other cities and towns, just the observation.
So part of that you have comes out of the state website.
Their figures.
Yeah, so basically for everybody's information, I try to include that in. So basically, it's as best as it can be apples to apples to apples for every municipality. And that is a published report based on the required data that we have to submit every year that gets audited against them. Yep. So what I put in gets audited and that flows through that.
Okay. Thank you very much for your presentation.
Jay, I have one more thing to say if I could. I know that.
Go ahead.
This document, and I do this for edification for everybody at the table. If you haven't seen it, the additional city spending for the Board of Education from 2010 to 2000 is a very extensive list of items that we do, like refinishing floors, new gyms, playgrounds, things like that. And the amount to date is over $13,300,000. So the city, through the mayor, through the Board of Aldermen, is always ready to come up and assist for these items, and especially when they come up in an emergency situation. So as John Inglis had said before, we want to keep a dialogue open, keep the phones open, and we should be able to handle these situations throughout the year. But thank you again.
Okay. Are there any other members of the Board of Aldermen who wish to speak? Okay, once again, any other members of the Board of Aldermen that wish to speak? Okay, well, hearing none, I think maybe we can entertain a motion to adjourn.
All in favor?
Oh, wait, it has to be them, doesn't it? Because it's A&T, yeah.
So moved.
So
Say
moved by
again?
Joe so moved it.
All right. Second, all in favor?
Aye.
All right. Ladies and gentlemen, thank you very much. I appreciate all your time and effort tonight. And I'm sure that if there's any other questions for the next upcoming meeting, we'll certainly have more. But if we can also try not to duplicate those questions, that would be great as well, just for a time-saving measure. Thank you very much, and y'all have a great night and drive carefully.